Student and new grad nurses, what do you know about pericarditis? Probably the only thing that they teach us in nursing school, which is chest pain, shortness of breath is the presentation. Do a 12-lead EKG. If on the EKG you see diffuse ST segment elevation, that's the buzzword that they like to use in nursing school and on NCLEX exams. If you see diffuse ST segment elevation, then your patient has acute pericarditis. And while that's not incorrect, it's not incorrect at all, it is an incomplete assessment. There's another part of the EKG that you should be looking for that's actually a better diagnostic and prognostic indicator of recovery. Would you like to know what it is? I thought you might. Lock in and let's learn. On today's episode of Make It Make Sense Cardiology Edition, I am going to teach you the things about acute pericarditis that they don't teach you in nursing school. This will be quick because it's game day and I have errands to run. I just wore my lab coat for this recording because I'm feeling kind of professory today. Acute pericarditis. This is not recurrent pericarditis. This is, I have never felt this before, your patient will say. I've never felt this before. I don't know what this is. And no, I have never had this diagnosis before. Acute pericarditis. What is pericarditis, first of all? Pericarditis is an inflammation of the pericardium. Well, what in the devil is the pericardium? The pericardium is the same as the pericardial sac. Interchangeable terms, okay? The pericardial sac is the fluid-filled sac that surrounds the heart. It is a protective sac filled with a discrete amount of fluid, and it serves as a cushion so that the heart doesn't get injured being in such close proximity to the other organ systems that are neighboring it inside the rib cage. Many different reasons why this sac would become inflamed. Typically, it involves an infection. Most often, it's a viral infection, although bacterial infections can be a culprit, as well as fungal infections can definitely be a culprit. But more often than not, it's going to be the result of some sort of viral infection. And we're talking, you know, pneumonia, flu, things like that. Your patient has been around some sort of sick contact, and now that infection has made its way to that pericardium. Pericarditis. Pericarditis is painful. It is absolutely painful. Feels like a sharp chest pain that's worse when they take a deep breath in, and relieved typically when the patient bends over forward to get that chest wall away from that pericardium. If you can imagine, you know, if you was to pick up something very, very heavy and you pull a back muscle out, that's inflammation. Or if you step off of a curb the wrong way, or, you know, twist your ankle while you're walking and you sprain it, that's inflammation. So imagine that level of inflammation that causes pain, but it's around the heart. So that can give you a better appreciation on your patient's pericarditis symptoms. To accurately diagnose pericarditis, you need two things. The very first thing, as we discussed, is your EKG. Your EKG, and I downloaded this just for instructional purposes, your EKG is in fact going to show diffuse ST segment elevation. And sidebar, for those of you who are not well versed in how to read EKGs and you have no idea what an ST segment is, what it looks like, what it's for, it's okay. Just hit that pause button real fast. Go back into the library of posts that I have. You're going to see one that has a title just like this, and it is titled STEMI, S-T-E-M-I, and I go over the entire ST segment and what it reveals with what's going on in the heart. Familiarize yourself with that, and then just come on back and join us where you left off. All right, cool. For those of you who are well versed in ECGs or EKG interpretation, let us continue. So as you can see on this EKG, look for the green dots. The green dots show where there's ST segment elevation. So you see it in the inferior leads, right? Keep on going over. You'll see it in the precordial leads. That's leads V3 all the way over to leads V6. Green dots. Everything is elevated. Now, there ain't no way in the world where you can have a heart attack, which is ST segment elevation, in every single artery in the heart. That's why pericarditis by diffuse ST segment elevation stands out on an EKG. Who's going to have a heart attack in all three major vessels? That doesn't happen. Here's what they don't teach you in nursing school that is a big piece of diagnosing and assessing recovery from acute pericarditis. See these pink dots? Look at the pink dots. The pink dots are reflective of PR interval depression. That's important. That is important. The PR depression, see that? The PR depression, that is actually a more accurate EKG finding for pericarditis, and is actually a prognostic indicator on how well your patient is recovering. What does that mean? So that means that once your patient diagnosed with pericarditis, and incidentally, yes, they would have had an echocardiogram by this time to look at the amount of fluid in the sac to make sure that we don't have anything along the lines of a pericardial effusion or, God forbid, a tamponade. But nonetheless, on your EKG, your PR depression, when your patient starts their respective treatment, the cardiologist, I'm guaranteeing you, the cardiologist is going to want a repeat EKG the next day. And it's not because they are looking to see if that ST segment elevation has resolved. We're not looking for that. We are looking to see if that PR depression has gotten any better. Because as the PR depression resolves or comes back up to the isometric line, that is your prognostic indicator that the pericarditis, the acute pericarditis, is actually resolving or getting better. Now, while this patient is in the hospital, the PR depression may not completely get back to baseline, but if you see movement northbound, we're on the right track. Patient symptoms should be getting better, and then they can continue the rest of their medication therapy as outpatient. What medications are used to treat acute, remember acute, not recurrent, acute pericarditis? Because this is an inflammatory condition, you need anti-inflammatory medications. First line is anti-inflammatory medications. Now, that's not to say that your patient may not get adjunct pain medicine, you know, like a narcotic of some sort, maybe a Percocet or a Norco, but that's not the staple of treatment. The staple of treatment is anti-inflammatories. So we are talking ibuprofen or aspirin or indomethacin or even colchicine. We do not give steroids with acute pericarditis because that can in fact worsen the condition and worsen your patient's symptoms. And we are here to do beneficence to our patients. We are not here to do harm. We are here to help. Once your patient is out of the hospital, they're feeling better, they've been discharged, maybe not 100% back to normal, but we're on the right path. When they follow up with cardiology as outpatient, you bet your bottom dollar they're going to do another EKG to see if that PR segment has resolved or gone back to baseline. They're also going to do an echocardiogram in the office, again, to assess the pericardium and to make sure that the inflammation has improved substantially or completely resolved. Oh, and incidentally, treatments for pericarditis, the anti-inflammatory medications that your patient will be on, they may be on those for several weeks. Anti-inflammatory medications can irritate the bowel lining, the stomach lining. So it would be prudent for you, nurses, please, to make sure that there is some sort of GERD medicine or acid reducer that's on board while they're in the hospital, you know, something along the lines of like a pantoprazole, just to make sure that they don't get any unwarranted GERD, reflux, indigestion while they're on these high-powered anti-inflammatories. Woo! That was good, wasn't it? Now you know some tips and tricks about assessing for acute pericarditis. And I promise you, learning about that PR, depression, you bring that up in your conversation with the cardiologist and they're going to think that you are brilliant. Absolutely brilliant, because again, they don't teach us this in nursing school. So you want to be a standout with your cardiologist or your cardiology provider, because again, it could be one of us APPs. Bring that up, bring up the PR interval, and that will make you stand out like a champ. You understand? All right, you're welcome. That will conclude it for today's lesson. Thank you so much, as always, for all of your time. It is game day. You see, we boo because we care. That's what Philadelphia means. You know, we are very impassioned. I got to go get game day snacks. Y'all have a wonderful day. Go Birds.